Critical concepts in managing a very small premature baby is what is called the golden hour approach to management. So critical period, when if you do everything well, it makes a huge difference to the outcome of the baby. And if there are mistakes, again, it impacts these babies in a big way. For example, if there is temperature instability, if there is infection, if there is hypotension, the baby gets something like IVH, which has a permanent impact. And hypotension can also increase the risk of PVL, which is periventricular leukomalacia. So the neurodevelopmental outcome of this baby will become poor just because you didn't manage the golden hour appropriately. So we have a few points to remember. Thermoregulation. So the small babies, your labor room and OT temperature should be kept at 24 to 26 degrees. You be prepared with plastic bag. If you have the ability to have an exothermic mattress, you bring it as well. The warmer should be on and a trained team should be there. It's very important that we have a team who can manage such babies. If you are a new team, you try to expose them to a busy unit by allotting them time. And if you discuss within the team, have skill drills on how you approach an extreme preterm delivery, it will help out, improve as well. And the respiratory care, timely CPAP, timely pressure regulation. You don't use high pressures. Consider surfactant early and consider insure if appropriate or intubate. So avoiding hypo and hypercapnia, avoiding overventilation, avoiding hyperoxia or hypoxia, all of these are important. Infection prevention goes without saying because these tiny babies have very poor immune system. And unless you prevent infection, it's very difficult to treat once sepsis gets in. We have something called IVH prevention bundles, which incorporate the first 3 days of care for the small babies, right from preventing hypocapnia, positioning the baby not to overextend the neck, just keeping them on the back, not to put them on the side, gentle suctioning, gentle handling, avoiding unnecessary handling. Even brain scans are not done in the first 3 days, and so on. So this helps to prevent IVH, and you have to introduce that bundle and train your team in that. Delayed cot clamping is another very important intervention which prevents IVH or reduces the risk. And of course, IV fluid management, hypoglycemia prevention, these come into the golden hour as well. In the respiratory care, some units consider caffeine as part of the golden hour treatment, especially if you're trying to keep the very extreme premature babies on non-invasive ventilation. So the earlier you get caffeine into their system, the more likely you are to succeed with non-invasive and not intubate such babies for apnea, for example. So this is a type of transport incubator which includes a ventilator. You can connect fluids and shift the baby to the NICU in a safe manner.